What we're doing is microneedling on our new surgery coordinator, Miss Nora. And so this is her first treatment. She's never experienced this before. And the reason that we're going to be working on her today, her concern is her under eye area. So the skin has become a little lax, and it's kind of getting a little, I don't like to say wrinkly because these are not wrinkles, but because that skin is so nice and thin, it starts getting a little crepey, and we want it to be thick and strong and stand up nice and firm. So with the microneedling, this will help densify the skin. It will help a little bit with some of her melasmas because it helps repair the skin from the inside out. So it's going to help a little bit of discoloration and a little bit of the texture right around the mouth and chin area. It's going to activate collagen repair, so that's going to actually help tighten and smooth and retexturize the skin and activate that collagen to tighten, okay? So are you ready?
I'm ready.
So today I've had her numbing for about 40 minutes with just a topical numbing, and I have everything in my pockets here. This is our skin pin microneedling device, and what I use is a sterile cartridge with 12 little needles inside, okay, and they're very tiny, about a 37 gauge needle, so it's not going to, it's going to be very clean, small wounding to the skin, okay, and so what I'm going to use is the Skin Fuse serum, and that just helps the microneedling device slide back and forth across the skin without any kind of we don't want to scratch it. We want it to be nice, clean wounds, okay? So I'll start on this side so that you can see. I'm just going to apply a little bit of the serum here, a little drop, and I'm going to gently smooth that out. We don't need a lot of it. And like I said, she was numbing for about 40 minutes. So I'm going to do a little test spot. And depending on the area that I'm treating, I can adjust the depth of the needles. So I'm going to start just medium depth here and do a little test spot here. So she should just feel a gentle vibration. How does that feel, Nora?
That's fine.
Okay. And you see, all I want is for her skin to start turning pink. So I can go as deep as to drawing a little bit of blood. But that does not necessarily mean you're going to get a faster or better result. So all I need is for the skin to turn pink, for the body to realize that the skin has been wounded, and that will activate the healing. And after each treatment, she will slowly start seeing the results of the treatment, the skin looking smoother, and especially around the eyes, which is the area of concern for her. So I'm just going to go lightly all over the rest of the face, just so that she can get that nice, even rejuvenation. But she's our new model since she's our new employee here.
We like to welcome them all with a little bit of treatment so we know exactly what we do here in our office and they can explain to patients, right, Amy?
Yes, yes. And don't forget, like, if you have any questions about the treatment, you see I can get really, really close to the eye area. But if you have any questions about this treatment, or if you are wondering if you're a candidate for this, if you have concerns about that under eye area and you're not ready for like surgery, come by. The consultation with me is complimentary, and you can give us a call to set up that appointment at 210-614-4320. But as you see, she's not even flinching. How does that feel underneath the eye area?
It doesn't hurt at all. It doesn't feel any pain, just a little bit of pressure.
Okay, so if you see here, I've got tiny little droplets of blood right there because that area is a little thinner. So, and I want to go over that area just a little bit more since this is the area of concern.
Okay, here's a question, the same question you just answered. If it hurts, does it hurt?
Not at all.
Perfect.
Can you open your eyes and kind of look up for me? Okay, so I'm going to get a little closer to the eye area here. And sometimes it will tickle because of the vibration, but I made sure to get really close to her eye with a little Q-tip a little bit of numbing. But this is what she expressed to me was her most concern was this eye area. And I did take before pictures. So after we're going to give it a few weeks and we'll let you see the before picture and the after picture. And hopefully we can get in a few treatments. But you want about 1 to 2 treatments to see, can I get a gauze please? To see maximum results. But so with this first treatment, you'll see just minimal, but you will see the eye area smoothing out. And if you see here, just dab off.
Amy, they're asking, does it target wrinkles, dark spot? Is it like microdermabrasion?
Microdermabrasion is a topical exfoliation of the skin. So this is going to help with any kind of damaged fibers such as deep wrinkles, fine lines, acne scars, chickenpox scars, even some, a lot of people have that little scar when they're a kid and they fall down, or even trauma scars to their face, chin, eye area. This will help with a lot of that scarring, all those damaged fibers. What we want to do is gently wound the skin and activate the body to heal from the inside out. Where microdermabrasion is only a topical exfoliation or scraping of the skin. So they're very different.
So this is called microneedling.
Microneedling. It has 12 needles, and we're gently wounding the skin. I'm going up and down and back and forth over and over.
Now we have a follower asking, what is the downtime?
Downtime, she will be pink for about 24 hours. So this is a phenomenal treatment with minimal downtime. So the only thing I would ask is do your workout before you come to get your treatment, do your shopping, your cleaning, all that good stuff, and just go home and relax for the rest of the day. But it's really not much of a downtime at all.
And how often can you get this microneedling procedure done?
Once a month is ideal. You can get 3 to 6 treatments in a row. And after that, you want to take a little break. Reason being is the kind of the shock factor. We're kind of wounding the skin in a very unexpected way, and the body is activating to heal. So yeah, as you see, she's getting that pink little hue.
How are you feeling, Nora?
I feel fine. It just feels like little vibrations.
Perfect.
Wouldn't believe that it was needles.
Awesome. So now we're going to go to the other side. This is something that you could come in and get done in, well, I would want to say over lunchtime, but we need a little bit more than an hour because I want to numb you for about 30-40 minutes. And then we could get started. And it takes about another 30 minutes to do the treatment. You could go back to work, but as you see, you're going to be a little pink. It looks like a pretty good sunburn.
Patients tolerate it very well, Amy. They go out of here and they really kind of go about their business and their day. So it's one of those treatments. If you plan it ahead of time and we have you on our schedule, we can actually do it at a lunchtime, and then they go home and do their daily routine.
And Ms. Cynthia encounters patients every day that come in for under eye filler. They think they need some kind of filler to help enhance their eyes, and that's the wonderful thing I love about Cynthia is she's very honest. We don't take advantage of the patients here. We will always recommend what's the best option for you. And so I get a lot of patients from Cynthia that have that little thin, crepey skin underneath their eyes, and they just really are looking for a fix. And this is a phenomenal option because we are literally naturally activating your own body to repair and thicken that skin back up. So it's going to last a lot longer than a filler because. Go ahead.
For those certain areas, she's absolutely right. So some of my patients sometimes will come in and they think, I need a filler in your lower lids. And many times I will do tear troughs. You've lost the fat. under your lower lids, I need a little bit extra to give you that nice soft transition. But other times I see patients that it's microneedling that they need to retexturize that area, and then I bring Amy in. She'll consult you right on the spot and say, you know what, this area is going to do much better with the microneedling. You really not lost the fat or the structure. You just need to kind of help out that skin texture. The other question we have is, what can we apply after the skin, after the treatment? What do you recommend, Amy, as far as?
That is a great question. So for today and tomorrow, Miss Nora will be using this rescue serum. She'll be gently rinsing her skin every 4 hours and applying the serum. And what that serum is going to do, it's going to help heal up the skin. And you don't want to use any kind of face wash, soap, sunscreen, nothing for today and tomorrow, because I don't want to cause any kind of infection. Don't want to have any risk of infection. So we keep the skin nice and clean, rinse it off with lukewarm water, and we apply that serum for today and tomorrow. And then after that, I recommend the TNS Eye Repair from Skinmedica. That will help activate collagen repair, hydrate the skin, help with darkness, all your concerns. So the TNS Eye Repair will be great. She'll be probably using the TNS Essential Serum and our HA5 Hydration Repair. So those are the treatments that she will be on after her 24-hour period after her treatment today.
How are you feeling, Nora?
I feel fine. Relaxed.
Okay, open your eye for me.
Okay, what are the risks and contradictions?
I think most contradictions, of course, I would say, someone that is that has diabetes, or that has to take anybody that has to take blood thinners, or that takes a lot of ibuprofen or medication for migraines, things like that.
How about patients that are on Accutane, Amy?
Oh yeah, we cannot treat anyone that's been on Accutane at least 3 to 6 months out. It just depends on how long you've been on it.
How about Retin-A, Amy?
I encourage people to use their Retin-A all the way up to the treatment,
Okay.
and then stop using your Retin-A for about a week or two, and then you can pick up back on the Retin-A. I'm not using a laser or any kind of heat. I'm just gently wounding the skin, so you can use Retin-A all the way up to the day of treatment. One thing I ask and I kind of insist on is no mascara, no eyeliner. As you see, I get really close to the eye area, and we are gently wounding that. So if you come in with makeup and your mascara and eyeliner don't come off 100%, there's a very good risk that we could permanently stain that eye area. And we want to lighten and brighten. We don't want to cause any kind of darkness underneath the eyes. So I usually will, recommend to my patients, please, the day of treatment, do not wear any kind of makeup on your eyes. Miss Nora was really smart. She brought some makeup removing towelettes that helped get rid of all her eyeliner and mascara today. So that was very helpful. So she had to wear makeup to get to work, to fix herself up for work, but she made sure to bring something where she could remove all her eye makeup, and that was very, very helpful, and it didn't take too much time. So that's also another thing that you can do. If you have to come from work, just make sure you bring your makeup remover. So how are you feeling, Miss Nora?
I feel just fine.
Yeah? Does any part of it hurt so far?
It does not hurt one bit, no.
Okay. Does your skin feel warm?
Yes, it does.
Okay, yeah, because you'll feel that nice warm feeling as the circulation comes to the surface.
Yeah, that's what I'm feeling.
So what we're going to do now, Miss Nora, is we're going to do your forehead and nose. And those are a little more sensitive areas, so I always adjust the setting to be a little more shallow in those areas because they are bony, so it's really thin skin really thin skin on the forehead and nose. So I will make the setting a little more shallow, and this does feel a little more sensitive So I like to do it in about areas of 3. So I'll do 3 fingers here, 3 fingers here, 3 fingers here. Okay. The vibration on the sinuses really sometimes will cause someone to sneeze. So I'm going to hand you these little gauze just in case you need to sneeze. Okay.
Alrighty.
Here we go. So I'm going to go right along this area here. Turn for me. Right along her brow bone here.
Again, if any of you have any questions or concerns or want to make a consultation appointment with Amy, please feel free to call us at 210-614-4320. Like us, share this on Facebook, that way patients and all your friends could see. We can answer any questions. It's all about education. Amy loves to see her patients and talk to them. You can bring in products that you're using. She can help you out with skincare analysis. It's just a matter of knowing what you ideally need for your skin type. She likes to spend the time talking to you and analyzing your skin prior to doing this procedure. Sometimes we do get patients that walk in the door and they meet her and they're seeing me, and then I turn them over to her and like, oh, can you do it today? I really want to have this done. And if you're a good candidate, wonderful. We'll get you in our schedule, try to fit you in the best we can. Again, San Antonio Cosmetic Surgery with Dr. Delio Ortegon and Michael Baumholtz.
Yes.
210-614-4320. Amy is our lead esthetician here. She'll go over everything regarding the treatment. And if this treatment is not for you, we could talk about the laser genesis, Amy, the IPL, chemical peels, any other treatments that are ideal for you. Microneedling is just one of our very, very, very popular treatments right now for our patients. So.
I can do treatments here that target melasma, brown spots, sun damage, redness, spider veins, nail fungus, laser hair removal. We treat acne. We treat all kinds of different skin conditions. And Miss Cynthia does all the fillers and Botox from Juvederm to Vobella to what is the one that goes underneath the chin? The chin?
Kybella.
Kybella.
Yes, Kybella. Sorry, I draw a blank. We also have Voluma for the cheeks. So you might be seeing Nora since she's our new employee here. And we all have gotten a few things done. Maybe we can ask Miss Nora to be our model for a few other things. So we're really looking forward to that.
Amy,
Yes.
we have a question. Is there any risk of scars developing after?
Absolutely not. This is a very gentle, shallow treatment. It doesn't go very deep. So I have literally treated tummy tuck scars that have keloiding, and it's really softened up those little knots and those keloids and help repair the scar. So, on the contrary, it doesn't give you any kind of scarring. It actually helps with any kind of scars. So, like I said, acne scars, surgical scars, trauma scars, all those things, it definitely will help.
And we have somebody that just joined. How often or how many treatments do you need?
It's ideal to get at least 3 treatments to start seeing some good results, and they're about 1 month apart. So you've got about 24 hours downtime, and it takes about 28 days for the skin to heal completely from the inside out. So I usually will tell people, no sun exposure. If you're going to go spend some time in the sun, get that all out of your system. That way, when you decide to do this kind of treatment, you can really dedicate the time that you need to get those maximum results.
So someone's asking where we're located. We're located right behind SeaWorld. We're at the Christus Hills Hospital, right behind the hospital, where the Children's Hospital is in that plaza, which is Plaza 3. Our phone number here is 210-614-4320. We're San Antonio Cosmetic Surgery with Dr. Delio Ortegon and Michael Baumholtz. Give us a call, like us on Facebook. any questions, please feel free to call. When you call the office, you can ask specifically for Amy if you'd like. Just let her know, hey, we saw your Facebook, we saw the microneedling, I have some questions. She'd be more than happy to talk to you and answer any questions. Again, Amy?
And all my
any
consultations are complimentary. So, I mean, if you like to give me about 30 minutes of your time, I can answer all your questions. And I would tell you if microneedling is the ideal treatment for your concern, or if I have anything else, or even refer you to Cynthia. She's our nurse injector, and we both have about 20 years experience. And so, Ms. Nora, how are you feeling today?
Just fine.
Okay, and it's minimal redness that you have. And so I'm going to take this serum. I'm going to put about a pearl size in my hand here. And I like to kind of tap the larger areas of the face and then just kind of smooth this out all the way down. Look up for me so I can get close to the under eye area here. Do you feel any stinging?
Maybe a tiny bit.
Where?
Just kind of feel flushed. Just when you
Touch
added
it?
that serum.
Yeah. So it's a little sensitive to the touch?
Just a tiny bit. Yeah,
Okay.
but
All right. But so you're not feeling any discomfort or pain?
not at all.
Awesome.
No.
Okay, and so that will be our demonstration for our live stream, microneedling. And like I said, we were working on her under eye area. So if you have thin little crepey skin that you're just not liking, you feel a little aged around the eyes, you need to build up that collagen, or you need to minimize pores and resurfacing, microneedling is the best for you. See you soon.